From the 22 News Plus studio, this is 22 News in Focus with Patrick Berry.
Hello, everyone, and welcome to this edition of InFocus. I'm your host, Patrick Berry. We're here in the 22 News Plus studios here in Chicopee. Today, we're having a very important conversation. This is for all you parents, grandparents, wannabe parents, whatever it might be. We're talking about a subject, and I'm going to check my notes because I want to make sure I'm pronouncing this all correctly. Perinatal mood and anxiety disorders, aka PMADs. And I'm very, very happy today to be joined across the desk by Cheryl Noel. She's a licensed mental health counselor and private practice owner. And Cheryl is here to educate us on all of this. And a funny story for you, we were just joking about this a minute ago. When I first contacted Cheryl, I said, not that this is anything I need to worry about, and postpartum depression and such. And she corrected me that men do suffer from it. But we will get to that part in a moment. Let's talk about what are PMADs?
All right. So like you said, it stands for perinatal mood and anxiety disorders. And it's a whole collection of disorders that surround the perinatal period. So most people just mention postpartum depression.
Right.
Post, the word means like after. And then, peri means during pregnancy. And then pre, that would be before. So perinatal is like encompassing the whole time around birth. And this can start before birth and go all the way up to like a year or even a few years after birth.
So when you say this could start before birth, during the pregnancy period, or could it even start as a couple is having the discussions of bringing a child into the world?
Yes, it can start before even, because there are people who are trying to get pregnant, people with
stressing out about it,
like some issues that they might be having, or even people who might be afraid of getting pregnant. Who knows? You might be in a relationship where there's a couple and they disagree about having a baby. So, all that stress can start before birth or
right.
before pregnancy and go all the way straight through, to all the changes after having a child. It's just it can be a very tumultuous time.
And again, it's not just women who suffer from this. This is, you pointed out to me, this is men can also have difficulty during this period.
Yep. So there's a lot of studies going on, and right now they say out of every 10 women, 1 in 10 women? 1 in 5 women can suffer from it, and it's 1 in 10 men can suffer from it.
Wow.
Yeah.
And I guess right there on the screen, some of the signs are depression, anxiety, panic disorders, OCD, PTSD.
Yeah.
How do you, when you're speaking with your clients, how do you identify which is the primary cause?
Just all the symptoms.
Okay.
Some of these things you'll notice they're already disorders in and of themselves, like
right.
depression, anxiety, PTSD. They're disorders in and of themselves, but when it's specific to the perinatal period, that's when it kind of gets lumped in with this. And you can just tell by just the different symptoms of it. Like the depression, you're just feeling sad all the time. You don't know what's wrong, crying, mood is down all the time. The anxiety, you're scared of everything. You're just always afraid of what's going to happen with my baby.
Right.
OCD type things. You feel like, oh, I can't do this good enough. I'm scared. What if I do something to harm the baby? PTSD can come into play, where it's like you maybe went through something traumatic during the birth experience, and you just can't get over that, and you need help getting over that. Bipolar disorder, and then I would say postpartum psychosis. That's a pretty serious one where, somebody can be having hallucinations, seeing and hearing things that aren't there. Their judgment is off, things of that nature.
So when are you first in contact with a patient? Is somebody recommending the patient to you, or does the patient finally get to that point where they say, I need help? Or maybe it's proactive. Hey, Cheryl, my husband and I, my partner and I, we're getting ready to have a child. What do I need to know? Or is it all of the above?
It's all of the above. Yeah, I have a client who has come to me just like, we're thinking about having a child, and we just want to work through some things before this happens. And they're having stressors due to other things in life. And they just want to kind of work on that before they even bring a child into the picture. And a lot of times it is somebody bringing in someone else, saying, this person needs help. can you just, talk to them and see if they need help? A lot of times, the women won't recognize it in themselves,
Right.
and dads too, because they think, oh, I should be tough. I got to be strong. So
Right.
they're not going to recognize it in themselves. So sometimes it takes someone from the outside recognizing, you seem like you're not yourself, or I noticed, you're just really not, you know, how you were before, and that just lingers. So, and usually it's like when it's a prolonged period of time of not being yourself, that's when you have a problem going on.
So, and I know I'm going to phrase this
Mhm.
incorrectly, and I apologize up front. Is it a biological, medical issue, or is it primarily a mental health medical issue?
It can be a mix of both. There can be several factors.
Okay.
So some people are more predisposed
Is
biologically.
it not generational? What's it? You inherit it. Is it like if my parents or my mother had a problem,
Yeah.
then there's a good chance I had
So
it.
in that respect, yep, it can be biological if you have a family history of like depression or something like that, or anxiety disorders, or if you yourself have suffered from some type of mental health issue in the past, then you're kind of more predisposed to possibly have this issue during the perinatal period. For other people, it's not biological at all. It could just be the situations going on in their life, like stressors, like financial stress, or just family
Housing
stress.
stress,
Yep,
job stress, whatever it
domestic
might be. Yeah.
violence, type
Right.
issues. So it could just be outside factors that are impacting them, and then they're showing symptoms. So that could just be not biological at all. Really just the situation and the environment.
So for those folks that may be watching this, would your recommendation be take a moment now, if and look at your life, look at those stressors, look at your
Yeah.
family history, and if whether you recognize you're having a problem with your current child or in planning a future child, now's the time to seek help. Is that sort of
I would say the sooner the better. As soon as you notice that you're feeling off in a way, or if somebody's telling you you don't seem like yourself, and it's going on for a prolonged period, then I would say it's time to seek help. Yeah, and this applies to any area of your life,
right?
as far as mental health. But in particular, when it comes to the perinatal period, um, when you're having to have the responsibility of taking care of a child, like especially after birth, it's really serious to seek help because you
Okay.
want to make sure that you're being okay while you're taking care of that baby.
We are up on our first commercial break. Stay with us. We've got plenty more to talk about. We're back in just a moment.
This is 22 News in Focus with Patrick Berry. This is 22 News in Focus with Patrick Berry.
Welcome back, everyone, to this edition of In Focus. Sitting across the desk from me today is Cheryl Noel. We're talking about perinatal mood and anxiety disorders, commonly referred to as PMADs. We kind of described them in the first portion of this conversation, and we hinted about it earlier. The guys, men can suffer from this too, but we are of the mindset of I'm the dad. I got to be the strong guy. I got to be able to handle it. But it is well documented and well known that men are extremely reluctant to seek mental health help.
Mm-hmm.
Do you see that same thing? And is that accurate in your practice?
I would say it is, yes.
Okay.
And there's actually a statistic that says only about 25% of men who suffer will get that help.
Only
So,
25% of the men who suffer will seek help.
yes.
That's astonishing.
Mm-hmm. So a quarter coming in for help.
You
Not
know,
the other.
it's funny. We were joking about it during the break. I remember when my wife first got pregnant, we were handed the book, What to Expect When You're Expecting.
Mm-hmm.
I think every mom and couple has had that book, and it's great. And I always joke, I have joked ever since then, is where's that book that says, okay, now you got an infinite hope, here's what to expect. Or when you leave the hospital, here's the instruction manual like you get with your brand new car. You don't get any of that. So you, for lack of a better description, parents just wing it. They try and figure it out on their own when there's actual help out there.
Mm-hmm. Yes, we have more people writing books about this kind of stuff now. Very helpful.
I guess we could jump forward a little bit because we're on the topic. What are some of the resources
Mm-hmm.
that that parents, couples, or family members might be able to rely on?
So we have, there's a lot of books out there. One in particular that I love for women, a book called Good Moms Have Scary Thoughts
Good
by,
moms have scary thoughts. I'm
yep.
going to pull up a series. Well, this is your website, but then we'll run through a series of 800 numbers and books and
Yep.
so forth. Good
So,
moms have scary thoughts.
yep, by Karen Kleiman, because I mean,
There it is.
women can have thoughts of like, I don't want to do this, or
Dads too,
even,
right?
yeah, yeah, or just thoughts of harming the baby, thoughts of harming themselves, things of that nature. So it's like, what do you do when you have that? You just hear all this wonderful stuff at the baby shower and everywhere else, like, oh, you're a mom now. You're just going to bond with that baby. Everything's going to be wonderful. But then what if it doesn't feel that way?
Right.
You go home and you have these thoughts and you're feeling all these feelings like depression, anxiety, whatever it may be. And you're thinking something is wrong with me, or maybe I'm not fit to be a mother, something like that.
Well, you stated earlier, all of the stressors of being a new parent could be piled on top of other outside stressors, work,
Yes.
paying your grocery bill,
Mhm.
whatever the outside stressors might be. Now you're just adding on top of that,
Yes.
and it people, I can totally understand. People just get to a breaking point.
Yeah. And I'll bring out, there's something called the baby blues. This is usually a period like maybe 2 weeks after you have a baby. And, it's a big life change.
Oh
So
yeah.
your hormones are going up and down with everything. And so you can feel like, just all the crazy roller coaster of feelings. That's normal. But if it lasts beyond that 2 weeks and it prolongs longer than that, that's when it's an issue.
So if the struggle lasts longer than those first few weeks, that's where you need to seek help.
Hmm.
But as you said earlier, it could be an outside force.
Hmm.
You as my sister, I might say, you know what, hey Cheryl, you're really having a difficult time. I think it's time, because you might not recognize it, or you might say to me as your brother, we might not recognize it. So you might need that outside force
Yes.
to guide you and point you in the right direction,
Yes.
or at least buy you one of those books.
Yeah, and I'll even point out too, one important thing is sometimes women are good at disguising it. Like, oh, I'm okay, everything's okay, putting on their makeup, looking all good. Nope, everything's fine. I'm pushing through it, and they disguise it when really they're struggling.
What, how important is it to have personal relationships with other parents, other people? Maybe
Mm,
they've not gone through the mental health
mm-hmm.
crisis, but is it important to have friends and colleagues and family members that you just bounce ideas off of? Hey, did your baby have colic?
Yes.
Did you go through this? What was your remedy?
Mm-hmm.
My baby's not sleeping. It's driving me. Is it good to have those other relationships you can rely on?
Absolutely. A support group is just imperative. You shouldn't be raising a child in isolation
What's the old
if that can
phrase?
be
It
helped.
takes a village to raise a child,
Yes,
right?
yeah. So, I mean, thankfully today, people don't know about it, but there's support groups available. There's a international organization, Postpartum Support International. They have support groups online that people can attend. They even have like calls, you can call in and chat with somebody. They have it for moms, they have it for dads. So definitely, you do not want to be isolated in struggles. This.
I know we talked about this briefly a little bit earlier in this conversation. Some of the warning signs is
Mhm.
that either your partner, family member, maybe even your oldest children might recognize. What are some of those things? And as I'm asking this question, what's running through my head is, you know, you're not sleeping well. But if you're a new parent, you're not
Mhm.
sleeping well. Period.
Yeah. Yeah.
And it's funny because I know some new parents, and they're not even new. They might have a 5 or 6 year old that's still not sleeping
Mhm.
well. So how do you know the difference between I'm not sleeping well because I have a new child, or I have a child that doesn't sleep well, versus I'm not sleeping well because I've got another underlying issue?
I would say it's all in the way the person is caring for their self. If they're really not able to take care of their self, you see them going downhill in other areas, like the appetite. They're not eating well. Their attitude. Feeling profound guilt. Just like I don't know if I'm a good parent or not. Shame, doubting themselves. Sometimes people might have intrusive thoughts. Maybe the baby's better off without me. Oh, maybe somebody else should raise this child. So just very negative type of feelings.
And obviously, stay ahead of those feelings, because the alternative, if something harmful happens to that child, then something harmful will happen to the parent. Incarceration, whatever it might be, suicide.
So I'll point out about that. That is one thing that makes that book, Good Moms Have Scary Thoughts, is important, because sometimes people will think, oh my goodness, this is dangerous. My thoughts are dangerous. Really, the danger comes in when we're talking about the psychosis part of things. The one I mentioned, postpartum psychosis. If you're having thoughts and all these feelings and you're worried about it, like, oh my goodness, I can't believe I'm feeling like this, and you're like in distress, that's one thing. If you're having thoughts like, I don't want this baby, they'll be better off without me, I should, get rid of this baby, or I should harm myself, and you're not feeling distressed about it, that's when the danger comes in.
Oh, wow.
Those are the cases, which are rare, but those are the cases where you might see something really bad happen. Other moms, they worry like, oh my gosh, I don't want to be like that. If you're worried about being like that, then you're not going to be that.
Okay.
Because somebody who's in that state, in that mental state, they're not even going to really realize like, oh, this isn't good. Like, the judgment is off. Those are the type of people who might carry through and actually do something to harm, the baby.
And that's where your casual conversations with friends, family members, tight-knit circle, coworkers, whatever it might be.
Yes.
Those outside folks will recognize those comments and those feelings, and recommend somebody seeking help. We are up on our second commercial break. Plenty more to talk about with Cheryl and I when we come back, so stay with us.
This is 22 News in Focus with Patrick Berry. This is 22 News in Focus with Patrick Berry.
Welcome back, everyone, to today's In Focus. We're here in the 22 News Plus studios. I'm joined across the desk by Cheryl Noel. She is a licensed mental health counselor and private practice owner. And today we are talking about, most people would call it postpartum depression, but it has a technical name, perinatal mood and anxiety disorders, aka PMADs. And PMADs, Cheryl, correct me, it's all treatable, right?
Definitely.
So, we kind of put a dark image on this earlier, but that's what you do. You treat this, and as bad as people may think it is right now or in the moment, they can come out on the other side a better person, a better parent, just by seeking help. And is seeking help a medicated help, or just through your experience and your knowledge, guiding someone away from the bad thoughts into the better thoughts? Or is it, again, a combination of both?
It's a combination. So it all depends on the needs of the person. If somebody's really heavily struggling with depression, they might need some medication to help them to kind of come out of that a little bit, just so they can be more attentive to themselves during treatment. Or even anxiety, just to kind of curb anxiety a little bit. Depends, but it's a mix of both for sure.
We've touched on this a few times here, and I think it's important to note that this is not primarily a female problem. I was a new dad at one point in time, scared out of my mind. I still remember, going home with my brand new baby daughter. I've never, except for my driving test, 10 and 2 on the steering wheel, except for that ride home with the baby in the back seat. But there's a whole level of stress for men too.
Yes, and I'm excited. There's actually a researcher. Her name is Anna Mach, I believe, and she did a lot of research on dads. And there's other research coming out, and they found that dads' hormone levels actually change during the perinatal period.
Really?
Yes, their hormone levels change. So they'll have like an increase in oxytocin, which is like, it helps them to bond with the baby, things of that nature. And then other types of hormones that change later on that give them like reward chemicals to their brain when they're like actually bonding with the baby and playing with the baby. So their bodies actually change, their brains and bodies.
So does that happen all the time, or are there cases where those chemical changes in a man's body don't happen, which would then, I'd say, be the precursor for suffering from a PMAD?
I would say it's probably situational that
Okay.
I don't know, but I would say maybe it has to do with how involved dad is trying to be. They found that some men feel really detached, especially during the early days, when mom is mostly doing the feeding and
Right,
everything.
right.
But if they will allow themselves to kind of be a part of that process, those changes
Change the
will.
diaper.
Yes.
Exactly.
Yep.
Change the
Yep.
clothes.
Your body knows. Your body will release those chemicals that you need so you can build that bond with baby and do what you have to do.
You get into the parenting mode. You get
Yes.
into the
Yep.
parenting mode.
Very much so.
Is through, and I'm spitballing it here, but through your experience, does someone suffering from one of the PMAD anxiety disorders decrease if they have a partner who's heavily involved in the parenting from day one, or don't know?
Decrease isn't.
So a reduction in the risk of suffering from any perinatal anxiety disorder is decreased. So, like, if I'm worried about my wife when she had first given birth or during the pregnancy, the more involved I was, the less at risk she was. Or is there no studies on that?
I haven't really heard of that
Okay.
happening because you can have a really involved dad and then the mom is just not feeling well,
Or
not
vice
doing well
versa,
with
right?
all this, or vice versa. So it just really all depends on the individual. I mean, of course, being supportive is going to be very impactful. To have a supportive partner,
Right.
very impactful. But that
Like I
doesn't
said, change the
necessarily.
diaper, change the
Yep.
clothes, get involved.
But it doesn't necessarily mean that the partner won't suffer from
Right.
something.
And if you're a dad out there and you notice your female partner is staying hands off, I guess, for a better description, for lack of a better description, kind of not doing a lot, that might be an indicator that something might be happening.
Some detached feelings, that's definitely a sign. Feeling detached from baby, afraid to interact with baby, things like that.
Exactly. I want to pull up one last time some of the resources. The professional counsel like you, it's what you do. There are postpartum support groups. There's PSI. It's an international organization. There's I think it's a UMass Chan school, Chan Medical School, something. They've got Lifeline for Moms, but there are a number of resources out there that people should take advantage of.
Yes, I want to encourage people, get help if you need help. If you see anybody that needs help in your community, it could be even in your church community, other communities, whatever it is, don't, just let somebody suffer because sometimes people don't know how to go and ask for help.
Right.
So please just encourage that person to get help, or even you offer help. It could be anything like, hey, I can cook a meal for you, or whatever it is. Anything to help someone to not just be isolated.
Let me take the baby for a couple hours or so.
Yes. Yep.
Cheryl, I cannot thank you enough for joining me today. A fascinating conversation. Thank you so much.
Thank you for having me.
This is 22 News in Focus with Patrick Berry.